Hey everybody, Dr. Horst here. So today I wanted to talk about low back pain, hip pain, trouble squatting, that kind of stuff. If you're like myself, that I like to lift heavy things and do deep squats, sometimes my hip flexors get really tight. And we talk about hip flexors all the time at the office. I'm sure we all have had one friend or another that said, oh, my hip flexor is too tight. Well, today we're going to talk about that and how to go ahead and work on it. So first of all, I just wanted to show you guys a little something here. So in this book right here, we're looking at the psoas here, okay? It's really deep. We would have a bunch of gut sitting on top here. All right, so it actually starts on the anterior and sides of your lumbar spine here, and it wraps around. And so if we look at the spine model here, so basically it starts here and it kind of wraps around and it inserts on the inside of your hip. And this is a really hard thing for us to work on our own. I've seen people that have used kettlebell handles. I've seen people do stretches and this and that. And while all that stuff works, a good way to work on it is going to be using your massage gun. So I'm going to go ahead and show you guys that today. Just get my stuff out of the way. So this is going to be done while you're on your side. So you don't have to have a fancy table or anything like that. You could do this on the couch. You could have somebody help you with this. But you definitely want to lie on your side because, as I mentioned, all your guts are going to be in the way. So when you lie on your side, what happens, interestingly enough, is your guts basically go to the other side and it opens it up. So we need to remember it's on the anterior and sides of our lumbar spine. So we got to kind of push a little deep. And so when you go to try to do this at first, just go ahead and take your hand and just kind of feel around, poke around, see what lives there. If there's something that hurts too much, that's usually a sign that you need to kind of work on it or seek medical attention. So I've located the belly of my belly, the belly of my psoas. And it's basically kind of in between where your belly button is and where this part in your hip is, okay? You're gonna be kind of going towards it. And what we're gonna do here is I'm gonna take the massage gun and I'm gonna start with it just right there. I'm pressing kind of at like a 45-degree angle. I'm not just pressing straight in, straight back, nothing like that, kind of like at a 45-degree angle. And what I'm gonna do is I'm gonna start with my leg up like this, and I'm just gonna bring it back as I give some pressure. So just like this, okay? And so I'm gonna go ahead and turn on the thing. And again, I do it on the kind of medium level resistance here. And I'm just gonna start here, and I'm just gonna bring my leg back, just like that. Just like that. More at that 45-degree angle, and then we go down towards that hip bone. Just like that. And as with everything, you want to spend 30 seconds to a minute doing that and do it on both sides. And for a lot of us that have low back pain, you'll notice that this really helps you too. Obviously, I wouldn't necessarily recommend this if you can't even bend down and touch your toes because your back is hurting so much. But any other time, go ahead and give that a try. Let me know what you guys think. Take care.